wa barakatuh. We pray to Allah subhanahu wa ta'ala to accept from us our fasting and our ibadah in this month of Ramadan. It is a big honor to have today with us Dr. Muhammad Shalabi. Inshallah, will give a very unique lecture about the benefits of fasting and other things, inshallah. So we're going to give him time to give his lecture, inshallah. If you have questions after that, you can ask. Jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh. Doctor. Allah يجزيك الخير. هذه أحسن لك.
Assalamu alaikum. My name is Muhammad Shalabi. Thank you for being here. Ramadan Mubarak. And as we know, Ramadan is a rukun min arkan al-Islam. It's a pillar of the arkan al-Islam. And Allah subhanahu wa ta'ala prescribed it on us, Muslims, and other religions prior to us. And there is a purpose for that. And inshallah, today we will talk on some of the medical benefits for the Ramadan and the fasting. I have here a diagram. I will go with it as a start just to get us the basics about how we gain weight and how other diseases happen in our body. So as we know, we all eat carbohydrates and glucose, as it said, as it's shown there on the yellow box. Our body will burn what we need, and the excess of it will be stored as glycogen. We store certain amount of glycogen, and the storage areas will be the liver and the muscles and the kidneys, okay? So when these storages are so full, our body will switch from glucose to glycogen to glucose to fatty acids, to fat. So the glucose, what we eat, it will be converted into fat when our storages for glycogen is very full. And these fats, because they are simple fats, for storage, they will not be stored. So it will be converted into complex fat. We call it adipose tissues, fat, and triglycerides. So everybody who goes to the doctor, and the first thing they will test cholesterol, triglycerides, and glucose, correct? Okay. So triglycerides, this is when your levels are above 150. This is here when we tell you, okay, watch your diet. A lot of diabetic patients, when they come, their high-level triglycerides above the 500, the best treatment for them, we put them on an insulin drip. A lot of patients, it's like, are you crazy? This is fat. Why are you giving insulin? Because they don't understand this diagram. So when we put them on insulin drip, the triglycerides level will go down. Okay? Okay. The reason I'm showing this diagram here, when we start having fat triglycerides, which is in other language, adipose tissue, it's the fat in the body. If we go and flip this diagram during fasting, okay? So our body now is deprived of glucose. Since we start storing this fat and triglycerides, because we have excess glucose, we can go the opposite pathway. So when we don't have enough glucose, our body will start utilizing the fat and the triglycerides. So our body will start breaking it down. And by breaking it down, there is ketones, and sometimes glucose can happen because we are reversing the process. And this is how we lose weight, okay? And this is how our modern diseases happen too. So when we have a lot of fat tissue and triglycerides in our body, this is how insulin resistance goes up. Fat and triglycerides, fat tissue, it's a living tissue. It depends on your oxygen. It depends on insulin to live. It will compete with your insulin production as well. So what is insulin resistant? Insulin resistant, it's like the money in your body to respond to insulin. When you have a lot of fat and the fat is competing with your body for the insulin price will go up. So let's say for an example, a muscle takes, let's say, 10 grams of glucose in exchange with 1 unit of insulin. But when your body has a lot of fat tissue, this price will go up to 2 units of insulin and goes up to 3 units of insulin. Some patients even on concentrated insulin U500, okay? So it depends on your insulin resistant. And this is how insulin resistant calculated. For a normal body, we about to make 20 to 25 healthy units of insulins if we have normal insulin sensitivity. But when the insulin sensitivity goes way down and there is resistance to it, this is when we require more units of insulin. That's why some patients, they are good with only some oral medications and some of them with insulin and high amounts of insulin. I know we talked a lot about diabetes, but losing weight is the key, because the more you shave off the excess weight, the more you are lowering the resistance, okay? And the other scientific benefit of fasting, seizures. Actually, this is one of the questions of the USMLE step 1 too. Fasting is used for children who have resistant seizures. They do not respond to medications. Why? Because one of the products of the fat metabolism, it's ketones. These ketones, they have anticonvulsant properties, and they slow down the neuron impulses and will help the neurons to recover as well. So ketones, they are the best fuel for the brain. Okay. Anybody has any questions about this diagram?
Can you make it a little larger?
So here is the same one, but in different ways. So you have the glucose, the carbohydrates, as we discussed. Then it will be converted into glycogen. The glycogen will be then stored in the muscles. The 2 major organs will be stored in, it's the muscles and the liver, about 30% in the kidneys as well, okay? And when the storages are full, so the liver is here, our waist will start getting bigger because, okay, we're gonna start converting fat. So the waist, thighs, closer, okay? And the muscles as well too. That's why there is another condition. A lot of patients, they will be surprised when they have it's fatty liver disease, non-alcoholic fatty liver disease. So this condition, it's because when the liver storages are so full, of glycogen, then this sugar will start converting into fat. This is here when we start having this condition as well too. Okay, and same thing for the muscles and the kidneys. That's why, and the more fat, triglyceride in your body will cause rigidity of arteries. This is how arteriosclerosis happens as well too, in the body. So our diet is the cause of our chronic diseases in a bottom line. So as we said here, the glycogen stored in the liver and the muscles, during fasting, it is broken down to keep blood sugar levels stable. Once glycogen stores are depleted, which is usually 24 to 48 hours, the body starts to rely on fat storage for energy, which is ketosis stage. Because the main product for energy, source of energy for fat metabolism is ketones. So glycogen storage capacity is 400 to 500 grams between the liver and the muscles. So once glycogen stores are full, excess carbohydrates are converted into fat and stored in adipose tissue, which is our medical term for fat tissue. So the fatty acids combined with glycerol to form triglyceride as well. One of the benefits of fasting as well is autophagy. Autophagy, this is a medical term. It's called about it, meaning that your body will start not eating itself. It will start looking for bad tissue to metabolize and get rid of. Okay, it will reduce the inflammation of the body and reduce insulin resistance, as we said, weight loss, and improve brain health, seizure treatments in kids, neuroplasticity, reduces oxygenation and improves neuron connectivity, and improves memory. A lot of people debate about the memory. Our brain favors ketones as a source of energy. Yeah, I know the first 2-3 days you will feel foggy, but after that, the brain function actually improves. Fasting is beneficial if our brain is used to ketones. But as we know, we finish from Ramadan, or after even Ramadan, on the Futur, we go right away with simple sugars. We drive the sugar way up to the roof, and our body, you are switching right, like suddenly the source of ketones into glucose, which is the body favors as a source of energy, not the brain. The body favors it because it doesn't spend a lot of energy to metabolize it. Okay, but if we continue like some diets, like the carnivore diets or the keto diets, they focus on protein and fat. That's why they call it keto diet. It's from ketones. You eat a lot of fat products with protein, with little carbohydrates. So the body will start focusing on utilizing the ketones for our energy source, okay? With small amount of carbohydrates just to keep the other functions, like for the muscles, okay? And sometimes you can utilize the small amount of carbohydrates just to keep the steady storage of glycogen in the liver. Other than that, it improves gut microbiome as well. So as we discussed the complex carbohydrates, it's very important for us to utilize, especially with our suhoor and breaking fast. A lot of individuals, they go and eat a lot of simple sugars such as juices. Juice is simple sugar. It's fructose. It's the worst thing. If it's not natural, the worst thing you can have. Complex sugar, as you see here. So you see the simple sugar. As soon as you eat it, right away it's released on your blood and goes very high the first hour, and then you will crash. The complex sugar, it steadily will go up, so the body will have the time to react to it. The pancreas will not be shot. It will start releasing the insulin as needed. The most important to know that our body doesn't make insulin on demands. Our body makes the insulin and it stores it in the beta cells, and it will be released as needed, okay? But when we overwhelm our system with high simple carbohydrates like that, the body will struggle to meet the demand. And sometimes that's why we call it glucose toxicity. So glucose toxicity, you are a healthy individual, but your stored insulin really can't meet the demand you are dumping in the blood. Some of the type 2 diabetic patients too, their insulin levels are fantastic, very good. But in some occasions when their diet is not appropriate diet or contains a lot of simple carbohydrates, the sugar will spike all the way high. No matter how many oral medications you will take, because all these medications like metformin, I'm talking about diabetes because few of the individuals here asked me to talk about it for this. If we can remember here, we have 3 sources to burn the glucose: muscles, insulin, and the liver. So the liver will convert it and stores it. The muscles, they will, based on your exercise, will burn the glucose. The metformin works on the muscle, okay? How? It doesn't increase your insulin release. It will go, like, let's say as an example, your muscle will take 10 grams of glucose. The metformin will go there and says, okay, it's time for us to open it to 12, 15 grams of glucose. But for this, you have to exercise. Because if you don't exercise, you're gonna, the muscles, they will be saturated with sugar too. If you don't burn it with the muscle fibers, exercising, movement, we will get to the same problem. That's why when you start on 500, metformin 500, then they increase it to twice a day, then to 850, then 1,000, then 2,000 a day. So if exercise is not implemented in your lifestyle, metformin will help you at the start, then you will start increasing the resistance to it. The other function of metformin, it will decrease the glycogen production, release from the liver as well too. So when you get hungry, it will be, instead of breaking down the glycogen to release sugar, the metformin will reduce that operation. So you can use the sugar in your bloodstream. Okay? Yeah. So in regard to glipizide, a lot of patients, they receive the glipizide, glimepiride, these medications de-stimulate your pancreas to release the insulin. As we said, the insulin is stored in vesicles in limited quantities based on your body's need. What this medication will do, they will go to the pancreas. Okay, I really don't care. Whatever storage you have, I want you to dump it. It doesn't help the pancreas to make more insulin. It just gives an order, blind order. Okay, I want you to dump this sugar, the insulin. Some patients, if they don't have stable diet, that insulin will be dumped, and this is when we go to the opposite direction. We'll go to low blood sugar too. Okay, and eventually most of these patients, because the pancreas will start working beyond its capacity, some of these individuals, they will end up in insulin because you are drying out your pancreas. You practically frying it. It's like a sponge. You keep squeezing till it tells you, okay, I give up. I'm not going to make any more. That's why we are hearing it's like he was type 2 diabetes converted into type 1. It's not, no, he's still type 2 diabetes, but the pancreas starts failing, even releasing insulin. That's why we call it insulin dependent. Now here, when we start introducing the insulin to replace the pancreas. So there is some good class of medications I was asked to talk about. It's the GLP-1 agonists, which is like the Trulicity, Ozempic, and Mounjaro. So these medications, what they do, it will slow down the metabolism in the body. It's practically, it will reduce your appetite. And other than reducing the appetite, it's like, imagine your muscle like a bag. Whatever you fit in, it's gonna keep stretching and taking more amounts. The GLP-1 agonists, what they do, these are the weekly injections for some people if they don't know what they are. They are used for weight loss as well as diabetes management. So they will slow down the food in your stomach. If you remember this diagram here, so the food will get in your stomach. Usually it sits about 3 to 4 hours. 3 to 4 hours till your body releases this to the intestine. With the GLP-1 agonist, it depends on the dose because there are multiple dosages. They will slow down this release. And instead of the ideal 3 to 4 hours, it will be prolonged. Some of them 5, 6 hours. It depends on the dose, as we said. So with these patients or individuals trying to lose weight, even if they eat complex sugar, I want you to remember, in the stomach, you do not absorb sugar. Sugar is only absorbed in your intestine. You absorb sugar only in the mouth and your small gut. It will start playing the role of the complex carbohydrates. So when all this sugar carbohydrates goes into your stomach, they are very, very slowly released into the bloodstream. This is how early diabetes or type 2 diabetic patients, or who makes, like, let's say 70% amount of their insulin needs a day, by using this mechanism here, you are giving the chance to the pancreas to react and take its time to react. Instead of dumping $200 the first 10 minutes, or just giving it dollar by dollar every minute. Okay? It's easier on the body, easier to replace the insulin, and at the same time, you feel full. Your body will start switching mechanisms because you are not getting the insulin on demand, the glucose on demand the way how you need it. Your body will start shifting into metabolizing the fat to meet your demands. Make sense? Yep. Okay. So for Ramadan, as we know, we need to focus on high in fiber medications, potassium, magnesium, because we lose a lot of these vitamins, and vitamin B6 especially, and dates. Dates, they are full of vitamin B6. Again, avoid fried, salty, and sugary foods. Avoid carbonated drinks because they will lead to dehydration. Caffeine, I'm guilty myself. I always drink coffee with suhoor and even with breaking fast. Yeah. Hydration, drink as much water as possible at iftar, suhoor, and non-fasting hours. Yeah, break the fast moderately, dates and water. Why? Dates, they are complex sugar. And when they start releasing, like, break your fast, drink your water, eat dates. Dates contain protein as well too, with the complex sugar and fibers. Your body will receive the glucose like little by little. It will not be in a rush and confusing your body. It's like, it's literally shocking your body when you drink juice or you eat donuts right away. Yeah, it's a shock to your body. Here we talk about the dates. They are high in complex sugar, fiber, potassium, magnesium, and vitamin B6. Very important for protein metabolism. Vitamin B6 aids in the breakdown and utilization of proteins. Homocysteine regulation. So elevated levels of homocysteine, it's associated with insulin resistance and cardiovascular disease. So vitamin B6 is important for homocysteine metabolism, which can be found in dates. Reduces the risk of developing insulin resistant or type 2 diabetes. Dates as well, they are very important for the neurotransmission production and enzymes. A lot of patients, a lot of people, they take SSRIs, this serotonin reuptake inhibitor medications to boost up their serotonin level for anxiety, depression, which vitamin B6 can do that as well. Dopamine increases the happy neurotransmitter, and the GABA, which affects mood, stress levels, and cognition. It's very important for red blood cells production as well, for immune system, hormone regulations, conversion of food to energy. We go back to hydration. So drinking water is very important. About 8 to 10 cups per day, 30 milligram per kilogram throughout the evening. Your urine can tell you about your hydration status. Same thing for protein. You should take 1 gram per kilograms. Here is some ideas. 20 grams for iftar, 10 grams for taraweeh, 20 grams for suhoor. Just break them down so you can have your enough daily protein intake. and complex carbohydrates with glycemic index. Thank you so much, and open for questions. Be easy on me, though. Go ahead.
Yeah, for the protein intake, you have the number of grams.
Yeah.
For the protein intake, you listed the number of grams that are suggested. Can you go back to that?
Yeah.
So what is an example of food? Like how much is in an egg?
Okay, so the egg, about 20. Yeah. Like 5 dates, about 15 grams of protein has in them. Yeah.
Excellent. And this is just for my wife. When you make juice and you remove all the pulp, doesn't that
You mean the
reduce
fiber?
Yeah. Doesn't that reduce the health benefits?
Fiber is very important for our gut cleaning, not only motility, it's the cleaning as well. Okay. And when you are making juice, you are practically only, we call it complex sugar. The reason we call these complex sugar because they are bind into the fibers and they are trapped into the fibers. Our body is not designed to break all these fibers down. So that's why when little chunk of fiber metabolized, the sugar will get released. One small chunk, sugar will get released. That's why you see the
glucose spike?
it's gradually getting into the bloodstream, okay? Not like the purified processed sugar. It's instant release into the bloodstream. So fiber is very important.
Yeah, but isn't that what happens when you remove the fiber?
Yes, exactly. That's why it's processed food.
Yes.
Yeah. Like when you have the dough, it's the same thing. It's, what do you call it? The wheat. The old time wheat, it was with its fiber. Now it's so processed, simplified. You know, it's like before it tells you like our elderlies, they tell you we ate bread all the time. We didn't have these problems. It's the processed food. Yeah.
So we should stay away from wheat bread completely because it's no good for us.
Wheat is good. It's look. This is here the slippery slope. If you do it organically, like how our elderly do it, do not clean anything. Keep it with its fiber. It's good. It's not bad wheat. Okay. That's why they tell you the brown bread with grain. The grain is very important key here. The grain is the fiber.
I got diagnosed with type 2 diabetes,
Mm-hmm.
and I'm trying to do it all by myself. I'm not trying to start taking medicine, and I haven't been exercising like I should be, but I'm finding that if I'm fasting, that I can bring it down to 135, and then when I eat, I overeat, and then sometimes it gets up to like from 190 to like 219. So can I still do it on my own, or do I need to start taking medicine?
You know, really, it will depend on your A1C.
It's really high.
How high?
11.5. It was 11.5. Once I found that out, I started watching what I'm eating.
Okay.
I overeat.
Like, similar to your situations here, my approach really, it's a little wild. A lot of physicians don't like it, but I think benefits the patients the most, and there is some research about it. Like in similar situations, anybody even in the 10, if they can't bring their blood sugar on their own down, I think insulin the first step I will do. In such a case,
Instantly, you say that
yeah, in such a case, why? Your pancreas is not even responding. There is some injuries to the beta cells, and it's struggling. Okay, but when you like use the insulin, let's say for few weeks, you are giving the pancreas the time for it to heal. Because if you're gonna start using the metformin, you will start using the glipizide. They will add insult to the injury. It's going to go to the pancreas. Okay, I want you to release insulin right now. I am injured. I really don't give a release it. Okay, and you are even failing even more. Giving small, short period of insulin, taking it really gives the pancreas golden time to recover. Think about it this way. You are working 12-hour shifts. Your boss comes to you, and you are tired. You have been working. Your boss comes to you, you know what? I see you are very good, very dedicated employee. Well, I'm going to ask you to work 24 hours. And you are already tired. What are you going to do? You're going to fail, correct? It's like you are setting yourself for failure. The other approach is I will come to you. I see you are a little bit struggling, but you are doing a good job. Let me hire somebody else with you to help you. You understand what I mean?
yes.
So, and most the patients I use this approach with, within weeks, they stop the insulin, and actually they start having. That's why you tell the patients, as soon as you start seeing your blood sugar going below the 80s, 70s, you have to stop the insulin. Okay. And to be honest with you, what is one shot a day? It's nothing.
I'm scared that my body's gonna get used to it.
Nope. If you are making it, you don't need to. You don't need to take it. You know, did you ever see any individuals taking as needed insulin? Why is it as needed? Yeah, it's as needed.
What if
Yeah.
he turns it and does his exercises? What if he don't go to the gym and does his exercises?
This is here what we said.
Okay.
3 ways to burn the sugar. Exercise. If you exercise, about 40% of your glucose intake will be burned. And you know, it's 1 + 1 = 2. If you think like, okay, I'm sitting here, I'm eating this plate of bread or rice, and I notice brings my sugar to 180, why don't have half of the portion? Okay, my body can handle, let's say, half the plate. I am already guaranteed making insulin enough for the half the plate. Why not to scale down?
I guess I'm testing myself to see what I can do, what I can't do, because I just recently found out.
Yeah. So
I'm trying to do it my own way, and you're telling me no, don't do that. So
no, it's if you exercise, I am with you. Do it.
okay.
The other way is to give your pancreas a time to recover. Like for you, healthy individual, about 60 grams of carbohydrates per meal. We are talking about 1 banana is 30 grams of carbs. If you do not exceed 60 grams of carbs, oh, you will be wonderful.
That's per day, right?
Per meal,
Per meal.
you will be good if you go by that. Exercise, do not exceed 60 grams of carbs.
Self-discipline.
Yeah, it is. You know, المعدة بيت الداء. Yeah, it's like most of our chronic diseases is really because of the diet. Whatever you put here, it will reflect here and here.
By the way, sometimes only in the stomach, everything is fine, but the fats appear.
Okay, where do we store the glycogen? Liver, kidneys. Yeah. So whatever access after, it will start going to the waste. That's why these individuals, even they have fatty liver disease. We call it NASH, non-alcoholic fatty liver disease. And you know what the treatment for it? It's weight loss medications. Yeah. So Ozempic, the same diabetic medications. Triglyceride can cause it a lot too. And why triglycerides? It's very high in the body. Because our glucose is very high. Our glucose intake is very high. Glucose, a lot of people, they think, okay, the fat, because we are eating fat, this is what's gonna reflect on us. No, it's sometimes there is peripheral pathways we convert the sugar into fat and triglycerides.
So how do you clean the liver besides medicine? Can you clean the liver, and how do we know that we have fatty liver? What is the signs and symptoms of fatty liver?
Most patients, they really find it accidentally on lab work. They will find the liver enzymes a little bit high by doing an ultrasound, sometimes CT scans. Yeah, it's incidental findings. Really, you will not be symptomatic. But fatty liver, if it persisted, it can cause liver cirrhosis, liver failure, and other conditions. This is when you start be symptomatic.
So be mindful of the sugar to prevent fatty liver, or the fatty liver comes from something else?
Fatty liver, it's the most of it because a lot of fat content in the liver. That's why they call it fatty liver. Okay. We don't want to be putting everything on the glucose, but some people, they are predisposed to it, but mostly because of high fat and triglyceride in the body.
So the meat, most of the meat that we eat, of course, they put fat in it. I don't know if it's fat or fat. I don't know if that's the same.
Okay.
So, what do? Just eat laham kubbi? There's no fat in it. You know, can do something with just laham kubbi? Or laham kubbi, there's no fat in it.
You know, the whole, inshallah, we will make, I don't know if we have few doctors here. What's your guys' take? Let me ask this question before I answer your question. On LDL, is it a good for our body or bad for our body?
It could be a two-sword. It could be a two-sword, can it? It could be, two-sword knife. It could be good for you and bad for you.
Do you hear me? I forgot his name. I asked a question. I know you.
LDL is we call it LAMC, but it has its functions also. So
Yep, exactly. So it's good cholesterol. It's good cholesterol unless it gets oxidized. So when we absorb this cholesterol, our body will put markers on it that is like not a foreign body. But even to the way how it gets oxidized, it's that's why we eat antioxidants. Let's put it this way. We have vitamins, antioxidants, K, D, A, plus vitamin C and all of B6. These are antioxidants. So sometimes free radical oxygen gets floating in the blood and hits these molecules, and it will unstabilize the receptors. Okay, and this is when it gets oxidized. Think about these receptors. It's like a pen with the cap. When you put the receptor, you cap the pen, so the pen can't write. When they lose that receptor, they will start attaching to the arteries. Some doctors, they don't like when I say LDL. It's sometimes a very good cholesterol, but in my opinion, every cell in your body needs it. Sometimes even when you have normal levels of LDL, it's not the case if you have a lot of oxidation or low oxidation. Yeah, back to your question. Yes, everything in moderation. Everything in moderation. Okay? Yep. Everything in moderation. Yep, and jumping jacks. Play soccer a lot. Anybody has any other question?
I can make a comment.
Yeah, go ahead.
I think, if you look at Ramadan, one thing that is not very clear, the concept is time restricted. It's not calories restricted. And I think that's where we go wrong, We are very happy that we are, fasting. But then, after iftar, then we eat the whole night. Some of us.
Yeah.
So I just want to make a comment about this because, I think it's self-defeating kind of a mentality. And I'm fasting and why am I not losing weight here? The other thing, one or two questions that were answered, I think you get a very good answer, but just to further clarify, the juices, we give it to children thinking this is orange juice, it's good, it's orange, But the orange is good, the orange juice is not good. And there is a difference between the two. When you eat fresh fruit, and we encourage people to eat fresh fruit, it has the fiber in it, and you cannot squeeze the juice out and throw the fiber out. You eat just the whole thing, So much so that even the bark is better to eat. If you can, again, you don't have to. The other brother asked about the bread. Bread is so bad that we should not eat it. It's the kind of bread that you should not eat. The white bread is all, very quickly absorbed and, it has no fiber in it. But, the whole wheat bread, there's nothing wrong with it. Again, you have to eat in moderation. And, there's the beautiful hadith of the Prophet, that, eat when you are hungry. Don't overeat it. I mean, that's so simple. So a lot of it is common sense, and Allah has given us the free will, which we should thank Him for, every day. We are not cats and dogs, that they have no free will. They just live on the instinct. We have instinct plus the free will. And then that's why we are responsible. If we do not exercise the free will properly, then we get into trouble. And the health issue is something which is physical and it's obvious. But we can lie and we think we'll get away with it. Eventually, He will catch up with us. One way or another, if not in this life, in the life hereafter. So without becoming too preachy, I think these are signs. If someone is having a hit, I'm not prejudiced. That's a sign to yourself, you're not doing something right, And think of it and take care of it. This day and age, thank Allah for everything. We have doctors every corner of the street. All these things are written up on the internet. You can educate yourself and take advantage of it.
Come on.
But thanks for the nice talk.
No problems. The good thing about Ramadan, it's 30 days. 30 days, really, if you utilize it in a good way, you will lose a lot of weight. You will regain some of your health back. And diabetes will go in remission, inshallah. Inshallah.
I have a question for you about drinking.
No drinking. Go ahead.
So if you drink, for instance, for Stoller, okay, let's say you drink a glass of water, but you don't eat anything for Stoller, let's say.
Mm-hmm.
How fast is that? Is that like putting a crunch on your system, taking all that water in at one time, or it'll go through your system slowly?
It's like the good thing, if your kidneys are really functioning properly, whatever its excess fluids, it's going to get out. You did drink a cup, you did drink 3, 4 cups, it will get out. Okay? So the rule of thumb, 8 to 12 cups a day, just to stay hydrated. But some individuals, with their diet, it's like it's moist, a lot of fluids in the diet. So they don't need to drink as much fluids
Again,
during
we're
the day.
talking about fasting,
Yes.
That's food, I'm not talking about throughout the day. So you're not drinking throughout the day, but you drink, let's say, 15 or 16 ounces.
Mhm.
That's food,
If it's look, this is all will depend after you did drink it, an hour. How much urine did you void? If you did void a lot, that means your body is hydrated. It really did not need much of it. I saw you raising your hand. Did you?
I think it's, if I understood his question.
Okay.
Health-wise,
Yeah.
health-wise, metabolically speaking, I think scientifically speaking, is there a difference between drinking too much water all at the same time or spread it over many hours, like if
Yes.
you're not fasting?
Mm-hmm.
Is there a difference to the body? Does the body sense it and acts differently, or is it just the same? You know what I'm saying?
Yeah, I understand what you're
It's like a
saying.
shock on your body.
No, it's not really. Other than you could dilute some electrolytes. This is when you are really starving for water. You are dehydrated. That's why when anybody we give bolus normal saline to them. Yeah, I don't think there is any. If you are hydrated, unless if you are dehydrated, it could dilute the electrolytes.
I have a question.
Yeah.
So when you said about the medications, the glipizide or glipizide, is there a way if we don't take that medication and take a Jardiance instead, will be that better?
Repeat
So-
that question.
So like when you talk about the medication, I know metformin is one of them. And then you said the glipizide or glipizide, which can act on your pancreas to squeeze it, or a side effect can be a low blood sugar. But if you don't take that medication and take a Jardiance, will that help?
Okay, so the way how Jardiance and Farxiga do work, it's practically, sometimes when we have a lot of sugar, it's our body's normal protection mechanism. You will start dumping some of the glucose in the urine. That's why when you go to do any urine analysis, they will tell you, okay, there is glucose in your urine. The first question, are you diabetic? You understand what I mean? This is how our body, it's one way for us to regulate the sugar. But it will not release very high amount of sugar. Jardiance and Farxiga, these are the same class of drug. What they will do, let's say your faucet in the kidneys for the glucose 10%. Jardiance and Farxiga will go, okay, let's increase this to 30%. So instead of releasing 1,000 grams of sugar, you will be releasing 3,000 and 5,000 grams of sugar. That's why they use it as 1% weight loss, because you are practically what you are eating. If it got to the blood, it will be filtered down the drain. Basically, it can help with blood pressure as well, and it will help to protect the heart as well too. There is some protection to the kidneys as well. It's recommended.
Any side effect on pancreas?
No, it doesn't. But sometimes it can interfere with the electrolytes. There is other conditions but it's safe. It's very safe. If your kidneys are in good shape, it can help significantly with diabetes. Yeah. Are we done? Okay. Thank you.
Thank you.